All right, let's jump right in. Today, we are tackling something that can look, incredibly complicated, the essential settings on a mechanical ventilator. But don't worry, we're going to break it down into the 5 core parameters you absolutely have to know to really get how these life-saving machines work.
So let's start with the most basic question of all. When someone can't breathe on their own, we turn to a ventilator. But how in the world do you tell that machine how to deliver a breath that's safe, effective, and even comfortable for a person? Well, the answer comes down to something called ventilator parameters. The easiest way to think about them is like the dials and settings on the machine. Every single one controls a very specific part of the breath, and getting them just right is absolutely crucial for patient safety.
Okay, so let's start from the ground up by building the basic breath itself. And this really just relies on 2 foundational parameters, tidal volume and respiratory rate.
First up is tidal volume, or VT for short. And put simply, this is just the size of the breath. It's the exact amount, the volume of air, that the ventilator pushes into the lungs every time the patient breathes in.
So how much is the right amount? Well, the standard is about 6 to 8 milliliters of air for every kilogram of the patient's ideal body weight. Now, that's a really key detail. We use ideal weight because a person's lung size is based on their height. It doesn't really change if they gain or lose weight. This makes sure the breath size is perfectly matched to the lungs themselves.
And this is where you can see it's a real balancing act. I mean, if the tidal volume is too high, you risk literally injuring the lungs from overstretching them. That's called barotrauma. But if it's too low, the patient just isn't getting enough air. And that's obviously really dangerous too.
This brings us to a huge point, a real pearl of wisdom you'll hear in any ICU. When you're in doubt, especially with very sick lungs, like in the condition called ARDS, the strategy is always this: low tidal volume saves lungs. It is a fundamental rule of lung protection.
All right, next up is tidal volume's partner, the respiratory rate, or RR. This one's pretty straightforward. It's just the number of breaths the ventilator gives every single minute. Its main job? To control the level of carbon dioxide in the blood.
So the key takeaway is super simple. RR controls ventilation. If you need to get rid of more CO2, you turn up the rate. If you need to hold on to more CO2, you turn the rate down. It's really that direct. Okay, so we've built the basic breath. Now let's get to its most important job, getting oxygen into the body. This is where our next 2 parameters, FiO2 and PEEP, come into the picture.
And it is so important to think of these 2 as a team. They absolutely work together to manage how well a patient is oxygenating. You can think of it like this. One delivers the oxygen, and the other one helps the body actually use it.
First in the duo is FiO2, which just stands for fraction of inspired oxygen. It's really just a fancy way of saying what percentage of oxygen is in the air that the ventilator is delivering.
So, how do we use it? Well, the air we're breathing right now is about 21% oxygen, and the ventilator can go all the way up to 100%. The goal is to keep the patient's oxygen saturation in a safe range, usually above 92%. But the golden rule is to use the lowest possible FiO2 to get the job done. Why? Because too much oxygen for too long can actually become toxic to the lungs.
And now for FiO2's partner, PEEP. That stands for positive and expiratory pressure. The best way to picture it is to think about a balloon. PEEP is like not letting the balloon completely deflate. It's that little bit of pressure the vent keeps in the lungs even after the patient breathes out.
So why on earth would we do that? Well, PEEP's main job is to keep the tiny little air sacs in the lungs, the alveoli, from collapsing shut after every breath. This props them open so they're ready for the next breath, which makes a huge difference for oxygenation. But just like everything else, if the PEEP is too high, it can actually squeeze the heart and blood vessels, causing low blood pressure or even lung injury. Another balancing act.
So if you need an easy way to remember what it does, just think this. PEEP props the alveoli open. It's that constant little bit of pressure that's holding the door open so oxygen can get in and do its job.
All right, we've built the breath, and we've managed oxygenation. Now it is time for the final touch, making sure the breath is actually comfortable for the patient.
And that is where our 5th and final parameter, inspiratory flow, comes in. Now, this isn't about how much air we're giving, it's all about how fast we're giving it. It's the speed of the breath going in.
See, adjusting the flow is all about getting the patient in sync with the ventilator. If the flow is too slow, the patient might feel like they're starving for air. It's this awful feeling called air hunger.
But if it's too fast, it can create really high, dangerous pressures in their airways. So the goal is to find that perfect sweet spot where it feels like the machine is working with the patient, not fighting against them.
We have covered a ton of ground here. So to make sure this all sticks, let's pull it all together with a really simple, powerful checklist. We'll call it the ICU Rapid Recall.
Okay, let's lock this in. 1, VT is for volume, that's the size of the breath. 2, RR is for ventilation, that's how we control CO2. 3, FiO2 is for oxygen, the percentage we deliver. 4, PEEP is for oxygen reserve, it keeps the lungs open. And finally, 5, flow is for comfort, the speed of the breath.
And there you have it. That's our foundation. These 5 parameters are literally the language we use to talk to the ventilator. They're the building blocks for every single breath that machine delivers. Which, of course, leaves us with one last question. Now that we understand the tools, how do skilled clinicians watch the patient and adjust these settings second by second to respond to a clinical picture that's always changing? Well, that is the true art of mechanical ventilation.